Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sensitivity and specificity of urine analysis in urinary tract infection. So, in urinary tract infection, if you do the esterases are sensitive in 83% of the cases and they are specific in 78% of the cases. Nitrites are sensitive in 53% and specific in 98%. So these are the sensitivities and specificities, but what is important is these esterases are more specific. But first, nitrates are the maximum specificity is seen by nitrates, but maximum sensitivity is seen by esterases or nitrites. Bacteria shows maximum specificity also, so these are important.
thank you and thank you for watching.